Hi everybody, we are Group 6 and this is Project IMAD.
Project IMAD stands for Informing Mothers About Diabetes. Our goal is to decrease the rate of gestational diabetes in low-income, first-time pregnant women between the ages of 16 to 24 in San Diego County.
These are the three main questions we'll be gathering results for and evaluating. Question 1 is, do mothers' attitudes about prenatal vitamins differ between intervention and control group? Number 2, is there a difference in nutritional knowledge in the individual in the intervention group compared to the control group after Project IMAD? And number 3, can the risk of gestational diabetes be decreased by providing education about prenatal nutrition, fitness, and vitamin adherence?
Our intervention group will receive these classes on top of usual prenatal care given by their Family Health Centers of San Diego clinic of choice. We will start with an introductory class about gestational diabetes, followed by 2 nutrition courses, a meal planning course, recommended prenatal fitness at the beginning of each trimester, and a class on vitamin adherence.
This is our project timeline, and we expect Project IMAD to take approximately 2 years. In the first 6 months of our first year, we will introduce a new clinic every month for recruitment. We will follow the same timeline of monthly appointments based on the trimester of pregnancy and schedule for regular prenatal appointments and testing.
We chose to utilize the health belief model. Our impact will be reducing the risk of contracting gestational diabetes, and the outcome we will measure is if mothers did contract gestational diabetes at any point of Project IMAD.
Our research design is a randomized experimental design using pre-test, post-test. The top line is our experimental group that will receive the full intervention represented by the letter X. The bottom line is our control group that won't receive Project IMAD intervention but will receive usual prenatal care.
We will recruit participants from 6 Family Health Centers of San Diego clinics. We will then sample within the prenatal unit and then randomly assign each mother into the experimental group or control group. Within the 6 clinics, there will be 20 participant mothers, 10 of which will receive the intervention and 10 will be in the control group receiving usual prenatal care. This will result in a final sample size of 120 women.
After we have our sample, we will be measuring our independent variables through survey questions given during the screening process. We will collect data such as race, age, and income. We will measure our dependent variable of gestational diabetes by periodic urine tests, oral glucose tolerance tests, and blood tests throughout Project IMAD.
To analyze the effectiveness of our program, we will use bivariate analysis. Question number 1 will be asked during pre-test and post-test questionnaires. We chose a t-test to analyze interval results. We found that the mothers in the intervention group had higher vitamin adherence. Adherence is defined as taking prenatal vitamins 6 to 7 days a week. Question number 1 will be asked during pre-test and post-test questionnaires. We chose a t-test to analyze interval results. We found that the mothers in the intervention group had a higher vitamin adherence. Adherence is defined as taking prenatal vitamins 6 to 7 days a week. Question number 2 will be a post-test only question. We used a chi-square to analyze ordinal data about the nutritional knowledge gained from Project IMAD. We found that the intervention group had higher percentages of women who felt they learned valuable knowledge pertaining to prenatal nutrition.
Our third question looks at the relationship between gestational diabetes and prenatal nutrition, physical activity, and vitamin adherence. This is our multivariate equation that evaluates the risk of contracting gestational diabetes.
These are our final results of Project IMAD in relation to our SMART objectives. 84% of the intervention group reported gaining nutritional knowledge and have utilized this throughout their pregnancy. 70% of the intervention group utilized the workout routines taught in our monthly classes. 85% of our intervention group made it through the whole program, missing no more than 3 classes.
Here's a graph of our results using Project IMAD. As you can see, the control group had a higher prevalence of gestational diabetes after the program. Out of 60 participants in our control group, 10 women contracted gestational diabetes. Out of the 60 women in Project IMAD intervention group, only 2 contracted gestational diabetes. We conclude that Project IMAD is an effective program in decreasing the risk of contracting gestational diabetes for first-time mothers. We recognize some limitations that we experienced along the way. Some of these include transportation to clinic appointments, language barriers, cultural norms, and personal costs such as time. Our one major advantage is that we found for every $1 spent on the program, it would save $5 in other costs related to the contraction of gestational diabetes. Some other advantages were the reduction of pregnancy complications, lowered risk of contracting diabetes postpartum, and a healthier, balanced lifestyle. This concludes our presentation on Project IMAD. Thank you.